Hello, today we will be presenting on the Community Health Improvement Plan called the CHIP. My name is Christine Gunn. I'm a public health strategist at the Rock County Public Health Department, and I'm also the HERE coordinator. HERE stands for the Health Equity Alliance of Rock County. HERE is a coalition that addresses health disparities and inequities in Rock County. It is a collaboration with over 100 community representatives that serve in the general body, advisory committee, and subcommittees. The Rock County Public Health Department serves as the backbone organization supporting HERE activities, but HERE members are the driving force behind the work of the Community Health Assessment and the Community Health Improvement Plan. On the screen, you can see HERE's recently updated mission, vision, and commitment statements. The mission is through community partnerships, we identify opportunities to remove barriers and advance health equity in Rock County. We envision a Rock County where everyone has opportunities to thrive and maximize their health. Our commitment is to create and nurture a space of integrity, humility, authenticity, and respect. HERE was created to advance health equity on the foundation and the belief that everyone should have the same opportunity to achieve their best health. Health equity is achieved when every person can attain their full health potential. When looking at equality versus equity, equality is the assumption that everyone will benefit from the same level of support. While equality may help eliminate some disparities, health equity goes one step further and stresses the importance of meeting individual needs and gives each person the support they need to get equal and positive health outcomes. HERE also uses the social determinants of health when addressing community health issues. The social determinants of health are the conditions in the environments where people are born, live, learn, work, play, worship, and age that affect a wide range of health functioning and quality of life. The social determinants of health include education, health and healthcare, neighborhood and built environment, social and community context, and economic stability. The social determinants of health are shaped by policy, which can heavily contribute to health disparities and determines one's ability to achieve their full health potential. Some examples include housing, access to nutritious foods, racism, and income. So now that we have given a understanding of the principles of HERE, I will now move on to review the community health assessment process. Every 3 to 5 years, HERE in collaboration with the Rock County Public Health Department conducts a community health assessment, commonly referred to as the CHA. This identifies key health needs and issues in the community. The first steps of the CHA are to gather data and assess the health of Rock County through various modes like surveys, interviews, and focus groups. These modes of data are collected from the community, which is called primary data. We also obtain data from other credible sources like the CDC, Wisconsin Department of Health and Human Services, and the county health rankings and roadmaps. This is called secondary data. From this data, we are able to see themes that rise as either areas of strength in our community or as areas we need to work on. HERE members then select which areas of improvement are most critical in improving health outcomes, and they are incorporated into the CHA report. So here are some of the examples of the strengths and areas of improvement identified in the survey taken by Rock County residents. The top areas of strength for the community are that Rock County residents have a good access to community parks and other recreation locations for physical activity. Rock County is a good place to raise a family, and it has good schools. It's a safe community, and that Rock County's environment is clean. The top areas of improvement for Rock County are that Rock County residents need a better access to affordable housing, that they need better paying jobs. Residents need better access to mental health services. We need more racial and ethnic diversity, and that Rock County residents need better access to affordable health care. So here are the 6 areas of improvement that rose from the data collection process. The 6 areas were economic stability, built environment, chronic disease, substance use, access to care, and mental health. Your members then voted for the top 2 priority areas, resulting in mental health and access to care being the primary areas addressed for this CHA and CHIP cycle. So now we will go through some of the data that led HERE members choose the 2 priority areas, starting with access to care data. The Community Health Survey found that more Rock County residents cited mental health and dental services as more challenging to access than physical health services. To break this down further, we asked why healthcare services are difficult to access. Results indicated that people have trouble with affording services, that they're too expensive, getting appointments, insurance issues, not feeling welcome, not knowing how to get services, language and cultural barriers, and issues with transportation. Knowing this information can help us improve access in our local community. In general, 4 in 5 residents said everyone in their household can always or often get the health services that they need. When we look at the same question in relation to some social determinants of health, it can show where people may have some challenges. When we look at the same question based on education level, we see one of the contributing factors related to challenges in access to care. More than 60% of respondents who had not completed high school indicated they had challenges with accessing care. This can be related to a number of factors, including the economic stability, insurance coverage in jobs that employ individuals with low educational attainment, and health literacy. When we separate responses based on ethnic backgrounds, language and cultural barriers are contributing factors in accessing care for 11% of Hispanic or Latinx compared to less than 1% of non-Hispanic or Latinx respondents. This shows that we can improve access to care by exploring this issue further and improving language services. When we look at responses based on racial identity, more than 1 in 10 Black or African American respondents indicated they do not feel welcome when seeking health services, compared to 1 in 50 white respondents. This shows additional areas to explore when developing interventions for our CHIP. So now we'll move on and look at some of the data for mental health. One common data point that we assess is death due to suicide. Over the last 10 years, we have seen between 20 to 35 deaths each year due to suicide. While the trend in 2019 was promising, in 2020 we saw an increase again. We can expect an increase through 2022 due to the pandemic, as we know that the pandemic further increased mental health issues. On average, Rock County residents indicate that nearly 15% of each month is spent experiencing stress, depression, and problems with emotions. This can negatively impact the community at large. Adverse childhood experiences are experiences in childhood from ages 0 to 17, such as abuse, neglect, and other trauma that have been shown to result in poor health outcomes later in life. Generally, as the number of reported ACEs increases, the risk for mental, physical, and behavioral challenges later in life increases as well. In Rock County, 1 in 4 residents indicate they have experienced 4 or more ACEs. This is the highest rate in the state. At a state level, high school students responded that half had experienced anxiety, about 1/3 experienced depression, 20% engaged in self-harm, and just under 1/5 considered suicide in 2019. Again, we expect these numbers to increase due to the pandemic. Having emotional support and a trusting relationship with an adult can support youth mental health. 1 in 5 children indicated they can get this emotional support when they needed it, while 4 in 5 indicate they have a trusted adult they can rely on. This indicates a potential strategy to build emotional support skills among adult populations that children rely on. So now that we have the priorities identified and the CHA report is published, we are able to move into the Community Health Improvement Plan process. The Community Health Improvement Plan, also referred to as the CHIP, is a 3-year action plan designed to improve the health of the county. The first step in the process is to identify goals and evidence-based strategies to improve mental health and access to care. To form a holistic view around the priority areas, subcommittees were created to determine the best plan of action to impact the health outcomes, also known as implementing the CHIP. The subcommittees consist of 10 to 15 volunteers that live or work in Rock County. These groups are responsible in finding evidence-based strategies that reduce the existing disparities and inequities in mental health and access to care. They then adapt the strategies to fit the needs of Rock County. Having a collaborative process with a variety of community sectors has shown to be more successful in improving community health. For this reason, we have included a diverse partnership in the process. So here's a list of those partners for the Access to Care Subcommittee. This includes health systems, city and county departments, community organizations, and also a school district. The co-facilitators who lead the subcommittee are from Beloit Area Community Health Center and from HealthNet. The co-facilitators volunteered to lead the subcommittees and were trained by Rock County Public Health Department and SSM Health to ensure their success in this process. Here's a list of the partners for the Mental Health Subcommittee, which is again a diverse group. The co-facilitators for this group are from the YWCA of Rock County and the Rock County Public Health Department. Here are the steps that we use to identify strategies addressing mental health and access to care. The first step looks at public health challenges that are evident from the CHAD data. This is also where we look at challenges specific to certain communities or subpopulations, and if there are disparities and/or inequities. The process then goes on to identify data that justifies the need for intervention and develop goals for the priority areas. It's always important to assess the capacity of the group and base decisions on realistic measures of success. Next, we look at the contributing factors that are creating disparities in health outcomes. Knowing this information will assist in finding evidence-based interventions using resources such as the county health rankings and roadmaps, the community guide, and state and national health improvement plans. The last step is to adapt these programs to meet the needs of our community and determine what activities will make a measurable change. Measuring change is key to this process, so the data can justify the need to continue a program, especially when there are external funding and/or partners needed. Using this process, here are the goals and strategies that the Access to Care Subcommittee developed. One goal is to improve navigation of healthcare services. The first strategy that we'll use to meet this goal is to increase health literacy. Some activities that will be taking place during the next couple of years are partnering with libraries to conduct trainings on how to access and use MyChart. We're also creating a community resource map that will be a one-stop shop for community resources. The second strategy is to improve health insurance navigation. For this, we will be working with Covering Wisconsin and health systems to help people either sign up for health insurance or understand their health insurance benefits. The last objective is to create a health system collaborative that would allow key players in the health systems to partner with the health department to make systems change through policy. The second goal for access to care is to improve patient and provider relations. We have objectives to improve language services and increase cultural competency within the healthcare systems. Cultural competency is the ability to interact with people from different cultures other than your own through knowledge and appreciation of cultural differences. The last objective is in this subcommittee is to grow diversity in the healthcare system. To help with this, we are going to be providing 8 scholarships for the community health worker trainings for members in our community. This will help supplement care in the healthcare system and within community organizations. With the mental health being the hardest service to obtain according to the CHA data, the first goal is to reduce barriers that people face in trying to receive mental health care. Some barriers that people face are stigma in seeking health services, mental health services, having a low mental health literacy to know when or where one can go to receive these services. Here we'll be working with the community to provide resources in reducing stigma, such as funding NAMI's Raise Your Voice Club in schools and providing mental health first aid trainings for community members. The last objective is to educate providers on disparities in health outcomes for Black, Indigenous, and people of color, and the lesbian, gay, bisexual, transgender, and queer communities. One activity we will use to educate providers is to support the Racial Trauma Summit put on by the Rock County Trauma Task Force that's going to be held in August. We will also be creating opportunities for providers to learn more about different cultures so they can provide the best care possible. The second goal is to increase social connectedness. Social isolation and loneliness have been shown to have similar adverse health effects as smoking 15 cigarettes a day. To mitigate this risk, we have an objective to create inclusive spaces for people to gather and connect. We will be working with youth groups to conduct an environmental scan of public places in the county and using that information to inform city and county planners. The second objective is to promote supportive relationships and intergenerational connections through programs such as community gardens and walking school buses with older adult volunteers. Now that we have the goals and strategies identified, we move into the last step of the CHIP process, where we put the strategies into action, known as implementing the CHIP. The subcommittees have recently moved into this phase of the process and will continue into this phase until 2024. With a 3-year cycle, it is essential to develop a work plan that states the steps to meet the goals and objectives of the program. The work plan keeps implementation of strategies on track by dedicating a person responsible for each task and showing when each task needs to be completed. Lastly, ongoing evaluation is used to measure the process of the interventions. Evaluation shows if the process went according to plan, the outcomes of the intervention, whether they are anticipated or not, and the impact that they had on the target community. Measuring progress helps to change procedures and policies and is a great tool to let funders and partners know if the program should be continued after the designated implementation period. So the CHIP report was recently posted to the Rock County Public Health Department's website under the Health Equity Alliance of Rock County tab. The goal is to have individuals or organizations use this document to help drive their own community initiatives We also will provide updates to the chip through internal changes of the work plans, or will externally take place through addendums on our website. One highlight of our CHIP report is our crosswalks for mental health and access to care. The crosswalks are a tool we use to compare the goals and objectives of the Rock County CHIP to the health improvement plans at the state and national levels to see where they align. For this, we use the Wisconsin 2020 statewide health assessment and the Healthy People 2030 plans. Many of the objectives for access to care overlap in the three levels, including health literacy and education, telehealth, and health insurance. Healthcare access and quality is a goal addressed at the local level and in Healthy People 2030. An objective within quality of care is to incorporate culturally competent care, which is an objective for both the Rock County CHIP and the state health assessment. For mental health objectives, the local, state, and national levels aligned to address protective factors and resiliency building. Social connectedness is also aligned at the local and state levels. It's important to note that policy changes and recommendations are being discussed throughout the three levels, as policy can have a great impact on improving community health. To support the CHIP's work, the Rock County Public Health Department was awarded an $100,000 Mobilizing Communities for a Just Response grant through the Wisconsin Department of Health Services, Division of Public Health. The funding is intended to support the first year of CHIP activities, develop new relationships, and build upon existing relationships. We continue to look for grant funding to support HERE's work in the next few years. For more detailed information, please review the CHIP report on the Rock County Public Health Department website within the HERE tab. If you have any questions or are interested in joining HERE, you can reach out to me using the HERE email above. Thank you for your interest in the 2022 to 2024 CHIP.